Repurposing anti-cancer drugs like RG-7112 to treat chronic musculoskeletal diseases represents a bold and rapidly evolving frontier in regenerative medicine. Originally developed to force cancer cells into apoptosis, program cell death, drugs like RG-7112 work by targeting the p53 tumor suppressor pathway, restoring its ability to kill cells that have become damaged, dysfunctional, or immortal. But scientists are now beginning to realize that these same pro-apoptotic mechanisms could be applied far beyond oncology, specifically to eliminate senescent cells that accumulate in aging tissues and drive a wide range of chronic conditions, including back pain, osteoarthritis, and degenerative disc disease. RG-7112 is a potent inhibitor of MDM2, a protein that suppresses the activity of p53, the body's master regulator of cell death. In cancer, mutations in the p53 pathway allow malignant cells to escape death and proliferate unchecked. RG-7112 reactivates p53, triggering apoptosis in these rogue cells. However, senescent cells, while not cancerous, also exploit anti-apoptotic defenses to avoid destruction. This is why they linger in tissues long after their useful life, spewing out inflammatory and tissue-degrading molecules as part of the senescence-associated secretory phenotype, SASP. These zombie cells are found in abundance in aging spinal discs, arthritic joints, and injured connective tissues, where they promote inflammation, block repair, and amplify pain signals. This makes RG-7112 and similar MDM2 inhibitors prime candidates for senolytic repurposing. The goal is to tip the balance in senescent cells, which are teetering on the edge of death but protected by molecular safety nets. By inhibiting MDM2, RG-7112 restores p53 activity, effectively pushing these dysfunctional cells over the edge into apoptosis, without harming healthy, proliferating cells that don't rely on such survival pathways. In this sense, RG-7112 acts like a molecular sniper, targeting only the cells that have overstayed their welcome. This approach has profound implications for chronic musculoskeletal disorders, especially intervertebral disc degeneration, a major contributor to chronic back pain. Disc tissues in aging or injured spines often become riddled with senescent cells, which not only degrade the extracellular matrix but also release factors that recruit immune cells and sensitize nerves to pain. Clearing these cells in preclinical models has been shown to preserve disc integrity, reduce inflammation, and even improve spinal flexibility and pain behavior. Repurposing drugs like RG-7112 offers a way to do this pharmacologically, without the need for surgery or more invasive interventions. The same logic applies to osteoarthritis, where senescent chondrocyte in joint cartilage and synovial tissues drive matrix breakdown and joint inflammation. Eliminating these cells could not only reduce pain and stiffness, but also slow the degenerative cascade that leads to joint collapse. Early animal studies have demonstrated that senolytic drugs can do just that, attenuating cartilage erosion and promoting a healthier cellular environment within the joint. The appeal of repurposing cancer drugs is also strategic. These compounds have already undergone extensive safety testing in humans for oncology applications. While their doses and targets in cancer are often aggressive and systemic, the senolytic use case may require only intermittent, lower-dose administration, possibly even localized delivery, e.g., into a specific joint or spinal disc. This opens up the possibility of minimizing side effects while maximizing therapeutic benefit. In fact, one of the major advantages of senolytic therapy is that it may not need to be continuous. Clearing senescent cells periodically may be enough to reset tissue health and allow the body to regenerate. Still, adopting a powerful drug like RG-7112 for chronic, non-lethal conditions requires careful recalibration. One concern is that while p53 activation is effective at removing senescent cells, excessive or poorly targeted activation could affect healthy cells, particularly in tissues with high turnover rates or latent DNA damage. The therapeutic window, where the drug clears only the harmful cells without collateral damage, is narrow and must be precisely defined. Researchers are exploring ways to fine-tune this through targeted delivery systems, senescent-specific biomarkers, and combination therapies that buffer healthy tissue against stress. In parallel, new generations of MDM2 inhibitors and p53 modulators are being developed with more selective profiles and potentially fewer side effects. These may offer greater precision in distinguishing between senescent and normal cells, enhancing safety for use in non-cancer indications. Moreover, some approaches aim to combine senolytics with anti-inflammatory agents or stem cell therapies to both clean the slate and support tissue repair, offering a comprehensive regenerative strategy. In conclusion, the repurposing of anti-cancer drugs like RG-7112 for chronic musculoskeletal diseases is a striking example of translational medicine at work. It illustrates how the molecular tools developed to fight cancer can be redeployed to target aging and degeneration at their root. If successful, these therapies could offer a fundamentally new way to treat back pain, arthritis, and other conditions, not by masking symptoms or replacing damaged structures, but by clearing the cellular debris that prevents healing. As trials expand and targeting becomes more precise, the idea of reprogramming degeneration into regeneration may become not just plausible, but standard practice.